welcome, you poor soul. You're about to watch a presentation from me. This is July 1st, 2022. I am E. Rosalie. I have a master's in interdisciplinary public health from the Johns Hopkins Bloomberg School of Public Health. This is addressing a lot of the conflicting claims that we're seeing out there about abortion and the recent ruling. I hope this helps. I so very much hope that you like citations. All the research, stats, and details are fully cited at the bottom of each card. A reference list has been linked in the post, and you can access all the sources there, and you can see the bibliography will be in alphabetical order, and so then you can look up the full citation for the in-text citation at the bottom of the card. So let's talk about Dobbs v. Jackson. This overturned the national right to abortion for women in the United States. There are some misunderstandings about what is still accessible, what is banned, etc. Abortion is not banned nationally. That's not correct. However, it is also not true that a woman who has an ectopic in every state will be able to get treatment, and I will talk about why that is here. So, no portion of the ruling grants the right to abortion to save the woman. It simply turns it over to the states. And not all trigger bans carved out exceptions for ectopic. Louisiana did not by name. It does make an exception for the life of the mother, but as we will get into in a little bit here, that's not helpful unless it's very specific, and almost all of these are far too vague to save anybody. On this topic, the life of the mother exception sounds like a good middle ground. Unfortunately, they often fail. Poland has exceptions for the life of the mother, but this hasn't stopped preventable deaths, and the same thing has started to happen in Texas. Already a woman was turned away with an ectopic pregnancy, and she had to drive 15 hours to New Mexico for treatment. And when you have ectopic, every moment matters. So I've included two examples so that you can understand what happens. The first woman is just known by Agnieszka T, and Agnieszka was pregnant with twins, and one of them died in utero, and they hesitated to remove the other one because of the risk to the remaining twin. As a result, both babies and Agnieszka died, but without the law, very likely two of them would have survived. Isabella Sabor was another Polish woman, and she became pregnant. She very much wanted her baby, and she found out that the baby had a rare genetic disorder. The baby was unlikely to make it to term, and if it did, it was unlikely to survive very long. However, with Poland's laws, she was not able to get an abortion. She was in the process of looking for somewhere to go. Isabella's water broke at 22 weeks, and she was in the hospital, and she became septic. The doctors and nurses hesitated to intervene because of the strict laws in Poland. They could be prosecuted, and so they did not want to do anything that would be seen as ending the child's life. This is a picture of Isabella. She became septic, and they waited for the fetal heart to stop before intervening. And this took several days. By the time they took her into surgery, she was unlikely to make it. Her limbs had gone blue. She had been convulsing, vomiting, and ultimately she died. This death was entirely preventable had they been able to intervene sooner. So in both of these cases, the women very much wanted their babies, and the doctors were unable to act to save their lives because of the nature of the laws. Now, there is an exception for the life of the mother. That's probably what a lot of people are thinking. But what happens is it's too vague. It just says, okay, you can intervene for the life of the mother. Well, how likely does it have to be that she's going to die? And who decides? Me being, a big advocate in autonomy and not making choices for other people, I would say that the woman should be the one who makes the ultimate call. But this is the kind of the catch with overturning the right to abortion. somebody else that decision has to be outsourced, and who it's outsourced to, how they estimate how likely death is. This all is unclear. So let's talk about some of the consequences. No, women will not be dying in back alleys, but they will likely die in silence, neglect, and isolation, and it has already started. Doctors are already acting much later out of fear of prosecution. Pharmacists are refusing to fill prescriptions, and women are getting infections, and this is a significant cause of death. In states where the clinics are forced to just completely close, those won't be available anymore to women who use them for things like screening for cervical cancer. And as a consequence, it'll probably be caught at a later stage. With cervical cancer, that tends to be pretty grim in terms of prognosis, but that is one outcome that we see with this. We also see that states with the strictest abortion access, you might expect that they might be more supportive of families. Unfortunately, they tend to invest the least in programs for women and children and families, and they tend to have the worst maternal outcomes. The number one killer of pregnant women is homicide, but on top of that, the U.S. has some of the worst maternal mortality rates in the developed world. It's 2 to 3 times other countries. Experts are concerned that criminalization will be followed by a surveillance state. And while this may sound like an overreaction, in the United States, state and federal tracking of menstrual cycles without women's consent has already happened. And period trackers have been punished by the FTC for selling the data. So that is out there. And there will be more options for tracking women. This data can come from online searches, social media posts, phone calls, texts, GPS tracking, purchases. The amount of information that would be accessible with the rationale that someone is suspected of having induced an abortion, it's really alarming. Bioethics and public health scholars warn that adverse pregnancy outcomes will become vulnerable to legal surveillance, civil detention, forced interventions, and prosecution. So we've seen this on a smaller scale already. Some people will have heard of women who are literally handcuffed to a hospital bed and forced to have a cesarean because the state thinks that's better than them attempting a VBAC. I think this would be that on steroids because they would have more authority. Often, a lot of really well-meaning anti-abortion activists will say, we're not going to criminalize or prosecute women. And unfortunately, that statement's false the second that they say it, because that's already happened. Nobody's tracking this data, but we do know of at least 1,300 women between 2006 and 2020. It's an extreme undercount. We know there's many more. ACOG, which is the American College of Gynecology, reports that women avoid prenatal care when they fear being charged with something. And any illness can become severe if they're not coming in and seeking care. Women who have substance use disorders will also avoid prenatal care because they don't want to be arrested. And it kind of fosters this mistrust, and women aren't telling their doctors everything that they really need to. So there's already some examples that are unfortunate. They are predictable, they are preventable, and they are often painful. In Texas, a South Texas woman was diagnosed with an ectopic pregnancy. I think I mentioned her earlier in the presentation. She was refused an abortion. She was told to go to the emergency room, and they advised her to seek care in another state. She had to drive 15 hours. Also, the misoprostol, which is prescribed to help empty the uterus. So in a miscarriage, it's a spontaneous abortion as opposed to an induced abortion. And in some cases, the uterus does not expel all the contents, and women can get infections that are life-threatening. Unfortunately, in Texas, we have pharmacists that fear legal liability, and they are refusing to give it if it's been prescribed. Another case in Texas, a woman was, I think, 17 weeks and her water broke. The baby was far too underdeveloped, and they said even with the best NICU care that they're not going to survive. They were very worried about sepsis and hemorrhage, and they would have normally recommended termination, but they could not offer it to her unless she became deathly ill, or she had to leave the state. That's just a situation that we don't want to be putting people in. A doctor in Alabama reported a patient who was in an active miscarriage, and she was forced to wait for 48 hours in order to get blood work, which was not the standard procedure, especially when she had all the clinical signs of a miscarriage, and that the intervention, which would have been a surgical emptying of the uterus, and it would have ended the bleeding and the cramping, nobody wanted to do it, and it's because they were afraid of being attacked by the state. Unfortunately, if you're hoping for good news, will the bans lower abortion rates? The answer is probably not. Criminalizing abortion has been shown to be effective in increasing maternal mortality, but it has not been efficient in producing the effect expected by legislators who vote to make abortion a crime, and that is, it does not seem to stop women from voluntarily terminating their pregnancies. Another study found that restrictive abortion laws are not associated with lower abortion rates. Taking a completely different perspective, there was a massive long-term study, and they found that a substantial increase in abortions across sub-Saharan Africa among women affected by the U.S.-Mexico City policy. It's a policy that started under Reagan, and it doesn't allow global health programs to have funding from the U.S. if they discuss or promote abortion. It may not be that that's what the funding is for, but the U.S. exerts that control. In the most affected countries, the abortion rate increased about 40%, and that is alarming. It is the opposite of what you'd want to see. The studies, no matter how you look at it, appear to show the same thing, that either the rate stays the same or it even gets higher. But you also have all these negative consequences that we're talking about. And one of the big negative consequences is women end up arrested. People who say that it won't be criminalized and that women won't be arrested, that was false before Roe was overturned, and it has already gotten worse. Middle-aged white women are rarely charged, and activists who deny the potential for criminalization largely fall into this category. So it's probably not that they're being dishonest. They may genuinely believe that it doesn't happen. The most extensive study of arrests wrote, "Our study also challenges the idea that arrests, detentions, and forced interventions of pregnant women are extremely rare. Our research shows that these state interventions are happening in every region of the country and affect women of all races. Critically, being charged, jailed, perhaps unable to make bail, and having your family taken away. The charges may be dropped, which means the punishment goes away, but there's a lot of trauma involved in that." We've also seen many states are introducing legislature that will open up avenues to pursue women, charge them with various crimes. Most of these states will say that they are exempting women if you ask them, but it's pretty clear that these would result in that, and it's not admissible in courts. If you are charged, you can't say, well, my senator told me that I am exempt. So what do these laws look like? Wyoming has introduced a new specific category of felony, felony child endangerment for drug use while pregnant. It resembles Tennessee's former fetal assault law, which they did away with after 2 years because of the chilling effect that it had on maternal and infant mortality rates, because people don't seek prenatal care when they're afraid. So Louisiana says that they are going to remove this language, but they did in May introduce a high-profile bill that would allow prosecutors to charge pregnant patients who undergo abortions with murder. Missouri wanted to propose a measure that would allow you to sue anyone who helps a resident of the state get an abortion outside of Missouri, and the legislation most closely resembles something like the Fugitive Slave Act of 1793. So a cluster of states have shown interest in passing legislation that would prevent residents from leaving the state and getting an abortion. The Texas legislation outsources the pursuit of the women to private entities like anti-abortion groups, which would make it harder to challenge in court. Arkansas passed the Every Mom Matters Act, which requires mandatory counseling. The counseling is generally through Christian groups, and they are not bound by medical privacy laws. The women are assigned a unique tracking number, and at least 8 other states are interested in this approach. And that could have grave implications if we're tracking outcomes at the state level, and potentially can lead to, if a woman has a miscarriage and she was considering abortion, that she could end up under suspicion. If you've made it to the end, congratulations. I hope that you found it informative. I know that this is a really difficult thing to talk about, and a lot of people are very dug into how they feel about it. I am personally a Christian, and so this topic has a lot of weight for me. What I do think comes across really clearly is that there's not clear benefit, but there is clear harm, and so I think that's something to think about. Please let me know if you found this helpful, if you have more questions, and if I can do anything to help further clarify. And if you have a subject that you'd like to see me cover in the future, please let me know.